Hello again, everyone. You're joining us for another episode of Executive Platform's Blueprint podcast series. My name is Geoff Micks. I'm head of content and research. My guest today is Nick Maragos of Northway Biotech. We're going to be having a conversation about how CDMOs contribute to the ongoing future of medicine, and with a special highlight of your organization in particular. Nick, thank you so much for joining me today.
Jeff, nice to be here.
Could we start off with a little bit about you?
So I'm by training, I'm a biologist, been in the business for about 30 years. And with Northway Biotech in particular, I'm in my fifth year, and I'm the vice president of business development.
Great. Can you give us sort of an overview of Northway Biotech, and then we can expand on that a little as we go?
Yeah, happy to. I think it's always good to start out with a summary, and it just makes it easier to have the conversation knowing up front what the company's about. So Northway Biotech is a biologic CDMO. We're really well known in Europe. We've been in Europe for 20 years. And decided in 2020 to build a second site in the Boston area, just minutes outside of Boston in Waltham, Massachusetts. Northway Biotech is unique in that we're privately owned. We're owned by one person. His name is Dr. Vladis Boumelis. He's very well known in the industry. Not only is he a very astute business person, he has multiple businesses, including this biologic CDMO, but he's also a dual PhD in biotechnology. So he also knows the clinical side and the technical side of the business. So we have two sites, one in Boston, as I said. The other one is in the capital, Lithuania, Vilnius, Lithuania. We have about 200 people in the company. We specialize in both mammalian and microbial production. And we have, like I said, been in business for 20 years. And that's from a track record experience, we've done over 175 projects, which is that's a lot of knowledge to offer for clients, and we have over 90 clients worldwide. So that's kind of the summary of Northway Biotech.
Terrific. I wonder if we could expand a little bit on the second site that you were mentioning in Boston. What is the strategy behind the second site?
Well, when you look at the United States, there's really three main hubs. There's others, but the three main hubs are Boston, San Francisco, San Diego. So if you're going to build a facility, build it where the clients are. But in addition to that, from a strategy standpoint, as I said, the site in Vilnius, Lithuania has been there for 20 years. Lots of experience, lots of projects. And the owner, Dr. Boumelis, decided that he wanted to go where the clients were in the U.S., build a site in Boston. And it was strategically set up so that the two sites have 99.9% of the same equipment. I think we have one European plug that doesn't quite match. And what that does for the client is, number one, our teams on both ends, Vilnius and Boston, have the technical know-how on the same equipment. And number two, if we're doing, say, process development work in Boston and we need to transfer that to Vilnius, it's the same equipment. So there's no revalidation of equipment. So strategically, it was set up to make it easier for clients to give them more options.
So I know you were speaking a little bit about the company's experience. I can understand it's quite a lot to go through. Could we talk a little bit about commercial experience?
Yeah, commercial experience, it's everybody's goal, I think, to start out at the talks phase 1, phase 2, and ultimately make it to phase 3 in commercial. Of course, the numbers dictate maybe something differently as to how many companies actually make it that far. So to get that experience as a company is just, and be able to offer that to clients is amazing. So Northway Biotech, we have two ongoing commercial projects. Obviously, I can't say too much about them, but they're both biosimilars.
And of course, we wouldn't want you to name names, but tell us a little bit about maybe the status of the project.
Yeah, these are two ongoing commercial projects. One of them is EMA approved, and the second is under FDA review.
I can appreciate CDMO as a broad term is something everyone's comfortable with. Are there particular services that you would want to highlight for people who are listening to this?
Yes. As a company that's a lot of experience, we know that it's easier for clients to do everything under one roof. Yeah, I think we learned a lot during COVID, where if you had a CDMO in different various parts of Europe, maybe even India, maybe even China and the United States, we saw that during COVID that became troublesome for everybody from a supply chain standpoint. So the fact that we can offer all the services under one roof, for example, you can, and that's at both sites, both Lithuania and Boston. You can come in, you can get cell line development done, all the process development work, including analytical development, formulation. We can scale you up to GMP manufacturing as well as drug product. And so both of the sites have all the necessary things under one roof to get you from cell line development to drug product.
Could we talk a little bit about the working relationship? I always think CDMO, it's such an important partnership to forge. You want to make sure you have a meeting of cultures, a meeting of values. You understand the data the same way. Talk about the working relationship.
It's a great question. Thank you. We're about 200 people, and I report right to the owner of the company, so we're a very flat organization. When clients want to do business with us and the clinical side, the technical side, we can make that as easy for them as possible because, number one, decisions can be made very quickly. We're not operating in different continents. We're operating me to the owner of the company. For example, MSA discussions and QA discussions, which can be long and drawn out, monotonous and boring, but need to be done. We can do things like that very quickly for a client. From a client's perspective, on the biology side, I always say biology happens. So when you have a project, things can go very well and things sometimes can go not so well. It's just part of what happens. And so from a communication standpoint, because we're a flat organization, we can communicate with the client and make sure that we're understanding what's wrong and, hey, we can fix the problem if there's a problem and produce this and execute this project for them.
You did mention a little bit earlier about your company's track record, but I wonder if we could maybe expand upon that. Walk us through your history in the space, please.
I'd be happy to, because again, that's what prospective clients want to know the most. What is your track record? Do you have experience with my molecule? So from a number of projects perspective, we've done well over 175. That just means that we can offer a lot of knowledge on a lot of different types of projects, over 90 clients. And from a molecule type perspective, most of our work is therapeutic proteins and monoclonal antibodies, but we also have some experience with yeast as well. Remember, as a CDMO, we offer both mammalian and microbial production.
I know one of the things that sort of sets you apart from other CDMOs would be BioCity. I wonder if you could tell us about that.
BioCity, yeah, this is a very, it's a big project. So Northway Biotech is involved in what's called BioCity. This is also located in Lithuania, in the capital Lithuania, Vilnius. This is a very big project. So I'll divide it up for you into BioCity 1, BioCity 2, and BioCity 3. But the overarching theme here is it's going to be the largest European biotech hub. So BioCity 1 is our two current sites where we can offer mammalian and microbial production both in the U.S. and in Europe. BioCity 2 will be large-scale mammalian manufacturing, and the reason why we're doing that is so that if we have clients that need to go through phase 1, phase 2, and on into commercial production large scale, we can sort of future-proof up their project for them and offer large-scale mammalian production. And that'll be around 2027, 2028. BioCity 2 is also cell and gene therapy. As we all know, cell and gene therapy has just been exploding in terms of both needs and in the marketplace for medicines. That actually opened up 2 months ago. So our current cell and gene facility in BioCity is open. So that's BioCity 2, BioCity 1, BioCity 2, BioCity 3, which will be a few years later. That will be large-scale microbial manufacturing. So that'll be 2 by 30,000. That's a lot of production and manufacturing from a microbial perspective. But again, what's that mean to the client? It just means that if you start work here with Northway Biotech, you can go all the way through commercial production if needed.
Really exciting. I know we have discussed a lot of things in this conversation already. If there were a couple things we wanted to highlight for people and have them think about a little further, what are some of the takeaways you hope they've got?
Yeah, good question, Jeff. I think it's really, I'll re-summarize what we summarized in the beginning.
Please.
We're a privately held organization, and I can't tell you how fun that is for me from the business development side to be able to make decisions very quickly for clients. I think we often surprise them how quick we can do things for them.
Time is money.
Time is absolutely money. Yeah, timelines are so important for clients. Time is money. You could almost say on a daily basis, time is money, for sure. So, kind of continuing with the summary of Northway Biotech, we're privately held. We're pretty easy to do business with. That's one thing. And then the second part of that is, can we execute a project? So from a track record and experience perspective, we've done well over 175 projects. We offer 20 years of experience. We offer 2 sites with the same equipment. And we offer 2 sites that have true end-to-end services all under one roof. So if you want to start with cell line development, continue through process development, GMP manufacturing, and drug product with one CDMO, you can do that. Well, I'll summarize my summary with time is money. So if you're doing all that under one roof, it makes it easy. You're not tech transferring. Your CMC program is not working with multiple countries, multiple continents, whatever it may be. It's all under one roof. So it's easier to do business, and we have the technical expertise to execute a project for our clients.
I have to think anyone who is weighing their options and has just heard that probably has some questions of their own. For people who want to learn more, get in touch. What is the best way to reach you?
There's many ways to reach us. I think that, again, we're kind of a flat organization. If you go to our website, there's a way to get in contact with us, an email there, and we answer within a day.
Fantastic. Well, Nick, I really appreciate your time. It sounds like a lot of exciting stuff is happening with your organization.
Yep.
I look forward to updates in the future. But in the meantime, this has been great. Thank you.
Appreciate it, Jeff. Thank you so much.
You've been listening to another episode of Executive Platform's Blueprint Podcast Series. I've been Geoff Micks. Let's do it again soon.